Teamwork matters to me the most. I try to keep my communication clear and kind, leadership, compassion, and time management. Good morning, good afternoon, good evening. This is Dr. Umer Khan, and today, a very important interview question, especially for internal medicine, family medicine, pediatrics, psychiatry. 3 strengths. And this is a very tricky question, but I'm going to give you a simplistic, short, concise, and a conversationalist answer. And I'm going to give you 3 answers, so stick around for all of them and see what fits your needs. This is for internal medicine in particular, but I have loads of videos on my channel with multiple other specialties, so do check that out. Let's get right into this. Thanks for asking this question. I know this would be asked, so I did prepare for it. So I do believe my 3 strengths include communication, organization, and empathy. I try to keep my communication clear and kind, especially with patients, and of course, not to forget nursing and other hospital staff. And I do recall during my inpatient internal medicine rotation, I used whiteboards to update families and patients so that they understand the plan and their medical concern. And I also believe that I am very well organized. On my ED rotation, I built template and checklists for different presenting complaints. And that actually helped me finish my notes, my follow-ups, and I submitted all of my documents in time. And then empathy, I believe, is what guides how I care for my patients. And I remember a patient who was significantly overwhelmed. I listened, I validated their worries, and I set up small goals and looped them in with social work. And that led to the patient being relieved of their stress. So I do believe that these habits help me stay calm, reliable, and patient-centered. Hopefully, this answers the question, and please feel free to go in any detail if you want. Now, the next answer, hopefully you like the first one, and this will be about adaptability, critical thinking, and teamwork. Well, thanks for asking this question. I was ready for this question because it's fairly common and I think a very important question. And I do believe that my strengths include adaptability, critical thinking, and a strong sense of teamwork. Now, let's talk about adaptability. In my rural rotation, I do believe that I adjusted quickly using what we had to help a patient with CHF. I was able to set that patient up with services in the community with lady health workers. And that, I do believe, is an example that I have reminded myself whenever I'm faced with a situation where I have to adapt. And then critical thinking. And I do recall that in my ICU rotation, there was a patient with a stroke with numerous comorbidities, and he did not seem to fit in a usual pattern. His stroke symptoms could have been a complex migraine. I reviewed the history, labs, and imaging with my seniors, and I suggested that yes, this possibly is complex migraines, and I don't think this is a stroke. This led to a diagnosis, and they did appreciate my thinking on this. And last but not the least, I believe teamwork matters to me the most. And during a busy rapid response situation, I helped the team and I helped coordinate with the nurses to get the adequate supplies. So apparently we were short of supplies. I helped them navigate and designate tasks to different nurses, one to bring a saline bag, one to bring medication, and the other to get the crash cart. So that was a hectic situation, and I do believe that I stay calm and collective during any of these situations, and I do believe that I do work well as a team. Having said this, I do believe that I bring flexibility, clear reasoning, and I do believe a strong sense of collaboration. Thank you. Next, I will talk about the strengths of leadership, compassion, and time management. Well, thanks for asking this question, and I know this was coming. It's a very common question, and I did think about this, so I did prepare for this. And I do believe my strengths include leadership, compassion, and a strong sense of time management. So I led a quality improvement project on our patients, asking them about their medication compliance patterns. And I actually set timelines, I delegated tasks, and kept us on track to deliver our goal within a month. And we did set a target for a month. So that was one of the projects that I do believe demonstrated my leadership skills. Now, number 2 is compassion. I do believe that compassion guides tough conversations. And to give you an example, during my palliative medicine rotation, I supported a patient and their family towards making a tough decision. And we used plain language that was comfortable for them to understand. And we gave them space to open up for questions. And I do believe that I did a pretty good job. Now, next and not the least is time management. And in a busy ER rotation, I believe I did pretty well. I personally saw 10 patients in 5 hours. I was able to prioritize my tasks. I used templates and lists, and I do believe I finished my notes, follow-ups on those patients, and I was able to sign out to the next team coming in. I think I have a strong sense of time management, but please feel free. If you have any questions about any of these examples, I can share more. Thank you. All right, I hope you like these answers. And if you do want a bit of a more structured approach, I do have a program. You can check for the link in the description. And you can also possibly get a chance to talk to me as well. Hopefully this all helps. But in any case, if you're looking for more expanded answers on this question, you can check out this video right over here. Thank you so much.